Hello, today is Friday, the 15th of April, 2022. My name is Nicole Ortegon. I'm interviewing Samantha Perez for the South Texas Archives at Texas A&M University, Kingsville. This is part of the Voces of a Pandemic Oral History Project in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Perez, that this recorded interview will be placed in the South Texas Archives at Texas A&M University, Kingsville, and shared with Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, especially given that your recording may appear online, I will honor your wishes. Also, if there is something that you want to talk about, please bring it up and we'll talk about that. Because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each one. There are 4 questions we need to make sure you agree to before we go on. South Texas Archives at Texas A&M University, Kingsville wishes to archive your interview along with any other photographs and other documentation at the South Texas Archives at Texas A&M University, Kingsville. We will retain copyright of the interview and any other materials you donate to the South Texas Archives at Texas A&M University, Kingsville. Do you give us consent to archive your interview and your materials at the Jernigan Library at Texas A&M University, Kingsville?
Yes, I do.
Do you grant South Texas Archives at Jernigan Library at Texas A&M University, Kingsville copyright over the interview and any material you provide?
Yes, I do.
Do you agree to allow South Texas Archives at Jernigan Library at Texas A&M University, Kingsville to post this interview on the internet where it may be viewed by people around the world?
Yes, I do.
Do you grant South Texas Archives at Jernigan Library at Texas A&M University, Kingsville consent to share your interview and your materials with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History Project, which will include posting the interview on the internet?
Yes, I do.
We have many questions in a pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voices server at the University of Texas at Austin. The final storing of the pre-interview form will be at the South Texas Archive at Jernigan Library at Texas A&M University, Kingsville. We will have stripped out any contact information for yourself or family members so that you will not be a part of your public file. Your public file will only be accessed at the Jernigan Library. Do you wish for us to share the rest of your interview in your public file available for researchers at the South Texas Archives at Jernigan Library at Texas A&M University, Kingsville?
Yes, I do.
On occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or email address with journalists?
Email, yes, ma'am.
Just email. Thank you for that.
Yes, ma'am.
So Samantha, can you please tell me a little bit about yourself?
Absolutely. I am a 38-year-old Hispanic female, and I come from a family that had never had anybody graduate from college or university. I was the first to actually graduate from my immediate family from college and then a university. I have 2 children, a son that is 8 and I have a daughter that is 3. I am a single parent and I have been a nurse since 2009.
What degree did you get when you graduated?
Initially, I kind of started from the bottom to the top. So I became a medical assistant in 2005. I got my licensure for nursing as an LVN back in 2009. And then in 2016, I graduated with my Bachelor's of Science in Nursing from Texas A&M Corpus Christi.
Tell me a little bit about your experience with COVID-19.
On a personal level or on a professional level?
Let's start with, how did you first learn about COVID?
I remember the first time that I heard about COVID, I was actually at work. I was employed at the time at Christus Spawn Hospital, Clayburgh. I've been employed there since I became a nurse and passed my boards in 2017. And at the time, I was having to follow up with the occupational health nurse at the facility to get properly fitted for an N95 for TB. So typically as a nurse, you come across sometimes immigrants that are trying to cross the border and you're not aware of what type of contagious illnesses that they might have. So it's just a standard practice to do that annually. So it was that time. And I remember the occupational health nurse mentioning that, there was COVID-19. And at the time I was just completely I was like, what is that? So she said, COVID is in San Antonio. And I was like, what is COVID? I hadn't heard anything about it. So she educated me on it. And I didn't think it was nearly as serious as it evolved to. But that was the first time that I had ever learned of the pandemic. That was the very first time.
So what was your initial reaction? I mean, you said that you didn't really understand the magnitude of it at that time.
Right. I was not even aware of what it was. So it was like, what is COVID, And then slowly I start doing research based off of scholarly articles. There's a whole lot of publicity coming across, a lot of media out there, social media. So it's like you're trying to fit the bits and pieces together from fiction, nonfiction. Is this stuff just being made up? So it's trying to determine what resources you can read off of to learn about this illness, the pandemic. So I think one of the other things was, just as a nurse, a lot of times I had never experienced anything like this. So, typically it's like you have a patient that comes into the hospital that's got, they're having a stroke. There's a certain protocol that as a nurse you follow that along with the doctor's orders that are being given. So it was definitely a learning process because there was no research to go back to say, hey, this is the type of treatment that we have to start off with. If this doesn't work, this is our next step. There was no policy procedure. There was no type of a logarithm to follow to determine how we're going to treat these patients. So it was definitely concerning at a professional level, but then also to think about my safety for my family at home. So it was definitely a very big learning experience, along with all the other medical professionals involved in the care of patients that were coming in the hospital. And there were even quite a few that didn't make it out of the hospital. So it was definitely a huge learning experience.
And at what point in your work and maybe in your personal life did you realize just how serious COVID was?
So at first, I think one of the biggest things that I recall was, how is COVID transmitted? Okay. So you're having patients come in, there's a shortage in supplies. There's not enough research to determine how these patients are to be treated. And it's like, I remember one day I worked in the OR and, they're passing out N95 masks and we're given so many because of the shortage. And we're having to learn how to conserve what we have to continue to protect ourselves and, of course, protect others. And I think really one of the biggest things was the shortage of supplies. So we're talking about gloves, we're talking about masks, we're talking about gowns, we're talking about face shields, hand sanitizer, So it's all of these things where it's almost like you go into like, are you dreaming? Like, this is like something that you see on TV. Like at the time, it's like you can't even process, and things are going so fast, and there's patients that are critically ill that it doesn't even give you time to process what is actually going on. It's like, we're just on the go. We're here to make sure that we're able to care for these patients as best as we can based on the information that we have thus far, and of course to protect ourselves. One of the other big things that I felt that was when I realized, hey, this is really a big deal, was when they started just completely like closing, not completely closing, but just utilizing essential workers. Okay. So it's like, and then you hear on the news, the only way that you're able to travel is that if you're an essential worker. And at the time, Krista Spahn sent out an email with a letter that indicated, hey, if I get pulled over on the side of the road, and at this time there is a public like shutdown, I'm okay to be on the road because I'm headed to work. So that was another big eye-opening experience where, it's like, this is really real, you know? And then you see the news, and there's like, you see the numbers starting to climb, and, you know, lines at the grocery store. So it's like, definitely concerning, you know. And then on the medical side of things, not knowing, how are we going to treat this illness? How are we going to help these patients? So there's a lot of factors that arose during the initial time of the pandemic that arose to, you know, to make it was difficult. It was a very big, difficult learning process. And I think another thing too was working in the operating room. At the time, they even canceled all elective procedures. So on that note, there is a I would say like a sub department within the operating room called day surgery. So day surgery, it's like, okay, well, we're scheduling these patients to come in and to have these procedures done. And, you know, if it's something that's non-emergent, we're not needing to do it. So there was even a point in time where our hours were not what they were before the pandemic. So it impacted us greatly. The other thing too was, I know that there were other departments that were needing help. You know, the emergency room was full. I mean, to the point where they were needing to get extra staffing to go in and to assist with the need of the magnitude of the patient census within the ER. So our cafeteria was closed. It was more of like, we're not going to be having people in and out of the cafeteria. We're, you know, going to, yes, go ahead and feed our patients, and, you know, putting restrictions on, once they did open, what we can touch in the cafeteria. So it affected a whole bunch of different departments, of course, too, like the custodial side of things, the housekeepers, you know, trying to keep them safe and appreciating the help that they were giving us, because they were a big part as well of the pandemic, keeping things as clean as possible to make sure that it was a safe working environment for us too. So I know another big thing was a part of our hospital that was not being utilized was opened up, and they made some changes to the rooms to create negative pressure rooms. So these negative pressure rooms, as these, you know, these patients are coming in, there's nowhere to put them because there's such an abundance of these patients. They were able to make accommodations by fixing up these rooms to be able to have enough beds to provide care to these patients. So definitely there were a lot of different factors that were red flags to say, hey, this is really serious.
I want to touch on work-related challenges. So you mentioned that there was sometimes a shortage in hours for some of the workers. Did you lose hours in your position at the hospital?
Yes, there was a period of time where they had to, again, it was just not elective surgeries. It was just like surgeries that were emergent that needed to be done like right then and there. So in the department that I worked in, it was more of elective based. We did a lot of like, I would say like gallbladder removals. We did a lot of hernia repairs, a lot of gastrointestinal procedures like colonoscopies, endoscopies, just very different things that, yes, it can wait. There were some things that could wait. So, and during that time, what I tried to do to, make up for that time that I was not able to work in the OR was I tried assisting in other units, like screening patients that were coming in to be triaged and going in to see the emergency room doctor, or even we were even screening our own employees to be sure that they met criteria to be cleared to work and were not infected with COVID. So I did that also for a little bit. Another thing that I did as well was helped out, where I could in the emergency room. It even got to a point where we were even screening patients that were calling in and having questions. So all of these little things, I tried to make up for the loss in other areas that were in dire need of assistance.
Were you able to maintain your wages in that way?
Yes, ma'am. Yeah.
So you're telling me about how you're screening people for COVID and you're interacting with people daily. How did that impact your mental health when it comes to your children and being around your family after you've been exposed to this? Was there any changes that you had to make in your family life?
Yes, absolutely. I know that just normally on a normal everyday pre-COVID day, it was always routine to just my shoes stay outside of the house. So that was always routine for me. One of the things that I can remember was I kept looking and looking for Lysol, because Lysol makes a kind of like a detergent, but it's not quite a detergent. It just kind of helps like with the pathogens, the germs and, viruses, whatever it may be that you can carry on your clothes. So that was really, really hard to find. And that was one thing, as soon as I would get home, take my shoes off, before I would actually leave the facility, I would make sure just to, wash my hands properly. And then, proceed going home and undressing, making sure that whatever it was that I was wearing, even though I was wearing a gown, even though I was wearing gloves, even though I was wearing a face shield, I just still had this sense of I need to be extra cautious to be sure that I don't bring this home to my family. So it was just constant, just trying to be vigilant and being clean. My clothes. At the time too, another big thing was wearing the masks. I know I recall hearing a lot of other nurses that had a lot of skin breakdown. So that was another thing, just making sure to try to keep my face clean underneath to be sure that I don't have any type of like breakdown. And there was a couple of times where I know that my skin on my face did get irritated, and I even recall one day just going to the break room and I needed to take a break and taking my mask off, and I go to the locker room and I have a mirror hanging on my locker, and it's like just the impression of the N95 masks from wearing it so many hours. It was just definitely took some time to get used to. My hair, for example, the way that these masks that we would wear were actually made, one strap would go around the bottom of the head and the other was kind of like up above on the crown. So I had a piece of elastic that was extremely tight, that was like right over the crown of my head. So I got into the routine of, okay, well, this is how it is. I can't pull every hair out of my head out, but I started seeing, okay, well, these nurses, they're wearing like cute little hats. Like, let me order a couple of those on Amazon. And that's what I ended up doing. I started wearing scrub hats just to be sure that I could, keep my hair from being damaged from wearing those masks so often. So, but yes, definitely some, life-changing things in the workplace. And then of course at home to keep my family safe as well.
I know that COVID has definitely hindered our ability to gather. How did it affect your ability to gather with family and friends? And, who did you interact with on a regular basis?
So at the time, initially, I know that it was my husband at the time, my daughter, and my son, and we just we stayed home. It was just staying home and work and home and work and home. I mean, yes, there was the occasional, yes, I need to go to the grocery store, get what I need. Um, and I didn't see my mom, I would say, for probably a few months after the pandemic initiated, because it was just so we were trying to be cautious and making sure that we were safe. And then it's almost like you can't say, well, I know where this person has gone, that person has gone. Are they practicing COVID precautions to keep themselves safe and keep their loved ones safe? So it just kind of took a little bit of time for me to warm up to, making sure that, hey, we're good to go ahead and visit. So yes, ma'am.
I know that your daughter has medical issues and needs attention. How did COVID impact her ability to maintain that extra care that she needs?
So my daughter, yes, and that's absolutely right. My daughter was born very early. She was on a ventilator for, I would say, about the first 5, 6 months of her life. And one of the diagnoses that she left the hospital with was chronic lung disease. So at the time she was about 2, and it was more of like, we didn't, and she has a nurse that works Monday through Friday, 8 to 4. And at the time it was like, we don't have a nurse to come because, they're concerned about all of the COVID, what if you don't know? So staffing was kind of hard to get for my daughter to get somebody here. She's not on oxygen. She's not on a ventilator. She doesn't have a trach or anything. So she's able to breathe independently on her own. And it was just really for us as a family, just being cautious wherever we went with anything that we had to do, being cautious around the people that we were around, and making sure that, hopefully they were doing everything that they needed to protect themselves so that we could protect ourselves as well as her. So it really just being very, very cautious. We wouldn't take her out into public. She gets occupational, physical, and speech therapy. That was kind of put on hold for a little bit as well. Taking her to the pediatrician for me was very frightening in the very beginning, because I was thinking to myself, like, we don't know who was here before us. We don't know what did they come in for? So I was even hesitant, and I reached out to her pediatrician. I said, is there any way that, you can just refill her prescription for XYZ, and I can even pay the copay? But that didn't even fly. We still had to take her in. So it was just kind of like, we have to be super, super careful and make sure that we keep her away from touching stuff. Because at the time, again, we didn't know. So, or how long is COVID going to last on a surface or on plastic or on a doorknob? So just being super, super careful.
Was she able to wear a mask?
Initially, she was very hesitant. She would pull it down and off the ears. So it was kind of like redirecting her and trying to educate her. And children are like sponges, and even though my daughter is not verbal as much as your typical 2 3 year old 2 year old at the time, so it was like just trying to get her to comprehend, we have to wear this to be safe. And then she's pulling it off, and then her name's Matilda, we got to leave it on just so that we're safe, mama, just just leave it on. And it took a little bit of getting used to, and even finding masks that size to fit her at the time. So that was a bit challenging. And fortunately, I was able to get two, and we cherished those as they were our first before they started making masks. I'm sure you remember the fabric masks that people were making to try to help, so definitely a learning process for us all. Yes.
Now let's talk a little bit about your son. So he was, obviously, you said he was 8 years old. So at the time, how old was he?
7. Yes.
So he was in school.
6 or 7. Yes.
How did that affect you guys whenever school kind of stopped and
Yes.
everything was online?
Yes. So initially, I remember the school contacted the parents and said, we're not having school. And I remember they started to set up dates where you would go and pick up their actual paper copy of work. This was before they started doing the online thing, I want to say. And it was very challenging. My son doesn't like to do his homework. So if you can imagine mom trying to be teacher and, also trying to assist, then they, with the Zoom and learning about Zoom, that was totally new for me. Was, I don't know how to use this, like help IT, right? So just trying to learn all of the new dynamics of teaching this elementary, second grade or first grader. I think it all started, I want to say it was in first grade. I can't even remember, Nicole. So it was just like, but trying to get him to do his work. And then on top of that, as a mom, you see his frustration, and it's like, I think, he does need a break. He misses his friends. He misses the interaction, socializing with other children his age, the boredom of just being home, not being able to be around his cousins, and, just to be able to interact like a normal kid should. But again, trying to teach him as well, like the importance of hand sanitizing. I'm very big on hand washing. So just reinforcing that, wearing his mask, being cautious of like touching things. For me, that was a really big thing, like going to the grocery store. And I even remember that I would see, and I did it also for a period of time, wearing gloves to the grocery store just to get things off of the shelves, and then bringing your stuff, wiping everything down and then put it in your car. Or, normally he would go out and get the mail. It was no longer, Caleb, you can go out and get the mail. It was more like, mom or Jacob, go get the mail, and then bringing it in and then spraying it down with Lysol and letting it sit for a day before we can actually touch it and open it. So definitely a big game changer for Caleb. Most definitely.
And how do you think that it affected his mental health and your mental health, going through these changes?
Right. So I think as far as like his mental health, I think that it was very challenging for him. I think that he faced a lot of like, I know there was a lot of alone time other than, seeing your peers on, the virtual classes, and, birthday parties. I think there were, 2. And it was just very keeping distant from, like my sister or the nieces and the nephews, but still having them present to where we're actually celebrating his birthdays. So that was really, really tough for him. I think too, just the lack of socializing. I mean, kids need that. They need that to grow. They need that to develop. And just the company of other kids. So I think it was, I know it was difficult for him for sure.
Do you feel that the school provided you with adequate assistance during this time?
Yes, absolutely. My son attends school at Ricardo ISD, and I remember, from the learning how to get him on and off virtually, off the system. They were very helpful with that, getting paper um, assignments to him so that he could work on the assignments while he's on uh, in the virtual classroom. Another thing that they were very nice in doing was providing, breakfast and lunch. We would go and pick that up, so that he could have something to eat. I mean, yes, we do have food here, but that was another thing that I thought that was amazing that they did to help the students. I kudos to them for sure.
I wanted to ask another question regarding, you said, of course, we had food, but do you remember what it was like walking into the grocery store and seeing nothing?
Yes, absolutely. I know that it was, I'll start from the exterior, looking at a grocery store. I remember people getting to the grocery store before the sun was coming out. And I remember long lines wrapped around HEB, wrapped around Walmart, and then having, being 6 feet apart. That was another big thing, being 6 feet apart to keep the social distancing away, to avoid, being in close proximity of somebody that could potentially have COVID. I remember the toilet paper shortage. That was really, really crazy. I even remember like looking up a bidet just in case, you never know. So, but the groceries, yes, that was a big thing. Bread, eggs, that was really, really, those were like things that were very, very hard to come by. Canned foods, even meat, they were putting limits on how many packets of chicken you could take, how many rolls of ground beef, someone could take, how many bottles, cans of Lysol, bleach. So it was definitely like, where are we? Is this Hollywood? Like, where are we? Because it was like just something that you would think you would see in a movie. We were living it. So it was very scary, very, very scary. And then my daughter, one of the biggest things too, I failed to mention this now that we're talking about food. My daughter has a little feeding tube. Every month, she gets a supplies of the formula that she gets for her nutrition, as well as all of her supplies. So for me, that was a really, really big thing, and trying to be certain that my daughter is going to have absolutely everything that she needs, and what are we going to do? What is plan B in the event? I remember too, there was delays in deliveries for FedEx, UPS, all of that. So it was very, very concerning, trying to ration what little bit of extras that we had for her. It was scary. It really, really was when it came to her, because she has a condition called oral aversion. So when babies are in the NICU, they're typically like intubated. They've got, hoses, a gastric tube down their throat. So there's different things that they've just got a whole lot going on around their face, monitors beeping. And so sometimes these NICU babies develop what they call oral aversion. Doesn't mean that there's anything wrong with her swallowing capability, but they just don't want anything near their mouth, nothing near their mouth. So they had to go ahead and do that, put the G button in so that she could be fed with a little feeding tube, so that she would continue to grow and develop, the way she should. So for me, that was a really, really big thing. And that was one of the biggest things that scared me, was how are we going to make this happen? If we don't get her formula, if we don't get her supplies? So that was, and then is there going to be a shortage of her supplies? So all of those things were constantly like running through my head. And thankfully we made it clear and did well throughout the pandemic. But I think overall the grocery stores was one of the biggest topics too on social media, where it's like even people fighting for food, or, you know, trying to running and to go get the food, and then, you know, somebody falls or gets hurt. So and now that we're talking about grocery stores, I remember going in and getting items, and I would see the elderly there buying things. And at the time for me, it was just more of like trying to educate people that were at the grocery store, especially the elderly, and talking to them with a caring demeanor to be able to tell them like, it's not, you know, it's better, not better, but it's, you need to wear your mask over your entire face, because that's how you're going to protect yourself. And as a nurse, I want to share that education with you so that you're okay, so that you get home safely and you keep everybody in your household safe. So I even took it a step further to do that, even in the grocery stores or at the gas stations, when I would see people that may not had known or didn't completely understand that, you know, just putting on your mask properly, to be kind and to help educate those that didn't know, you know.
I know during the pandemic, there was a lot of backlash from folks that didn't want to wear their masks. How did you feel about that? And did you run into anybody that maybe gave you grief about you trying to help them?
There was, I think, yes. And I think also, just as a healthcare professional, I would see people, you know, I heard a lot of talk about people that were also, they were positive and still out in the public, and knowing that they were positive. One of the big things for me was a coworker of mine that shared a story. She said, you know, I went to the grocery store, and it was like she was treated like a monster. Like, you work with COVID patients, stay away from me. So yes, I do feel like as a nurse, you know, at that point you're doing what for me, it's my passion. It's something that I feel that God has called me to do. And when you put yourself at the front line of an illness that we have almost no research on, and then to be treated like you're some type of like a piece of garbage, it was just like, kind of, you get the stares and you get the looks. And I remember being on the phone with my best friend before the mask mandate was initiated, and I'm at work and I'm hearing all of these things, and I'm still wearing my mask, and COVID is slowly making its way to South Texas. And I called my best friend. I said, hey, Jen, I said, I know this is really weird, but I just needed some type of reassurance. And she says, what's up? I said, I'm about to go into HEB. I said, and I know there's people not wearing masks, but I know this whole COVID thing, and I'm learning that it's really serious. So I'm going to just put my mask on. I said, do you think people are going to look at me weird? And she says, Sam, she goes, they're going to look at you like you've got a cat on a leash. Like, it's just not, that's not normal. It's not something that you see. And I remember it was a Saturday that I had to work, and I'm dressed up in my scrubs. I've got my scrub hat on because we're already wearing the N95s before it's fully hit South Texas. And I walk in, and it's like walking through the door, and they've got, you know, people with like hand sanitizer, but it's like they look at me and they're like, and I'm just like, do I look like, and I mean, yeah, it wasn't something that we were accustomed to. So it was like, I looked like a foreigner, like, what is this girl thinking? So it was definitely like, I remember, so for me, I told my best friend, I said, I think I was really one of the very first ones that walked into HEB. I said, because of the feedback that I got off of their, you know, their facial expressions and their body language. I said, but you know, I'm here to keep my kids safe, and so that I can stay healthy to continue to help those that you know are sick. So another big thing that that I wanted to mention was, did you ever hear about the Regeneron infusion?
No, tell me about it.
Okay, so the Regeneron infusion was later, they started utilizing this drug that would pretty much help fight COVID. So we already had like the COVID unit set up. We had, patients in ICU that were sick with COVID. And then we had in our general population, people that were COVID positive, but not sick to the point where they needed to be hospitalized. So we hear about this drug, Regeneron, and they also call it monoclonal infusion. And at the time, it was just something that, okay, well, what is this? So it was like a pharmaceutically created medication that would assist like boosting the immune system to help fight COVID. So what they did was they brought that drug to Christus von Kleberg. And we were one of the very first hospitals or entities in Kingsville to start administering that medication. I don't think it was administered anywhere else, to be quite honest, in our community. So they decided to choose the staff from day surgery, the OR, which was where I worked. And I had two other nurses that I work with very closely. And one of the nurses was opposed to it. She said, this is not something that I'm comfortable doing. I just feel like, it's a big, and it is, you're being put right with patients that are COVID positive, So what we ended up doing was the other girl and I said, you know what? I said, I want to help as much as I can. I will be as safe as with utilizing all of the PPE protected, the equipment that they're giving us to just be safe. I can help these people stay out of the hospital. I can help these people recover faster. So it was like an honor for me. I was just like ecstatic. I'm like, okay, like, let's do this. So my boss comes to me and he says, okay, well, we need to determine how are we going to do this? Is this something that y'all want to do in day surgery? Because we can convert one of the rooms into a negative pressure room. Do you guys want to do this strictly in the COVID unit? We can have rooms set up just to do it here. So again, this is like, we have nothing to look back onto. How are we going to do this? So it was, to me, it was like, I feel like, and I would tell my fellow colleagues, like the doctors that I would work with, and there was a hospitalist named Dr. DeVay, and I would see him and I would say, Dr. DeVay, I said, come on, let's take a selfie. He's like, why are we taking a selfie? I said, because we're part of history. We are part of history. I said, so let's do that. Come on. So we would take a selfie. And for me, it was just like, we're helping the community. So back to the Regeneron. Well, we started by making phone calls. And I told my boss, well, it's only two of us. We can only do this. We can only do so many at a time. We can only do so many in a day. I said, so let's try this. I think we started out like the first go around of infusions. We had two separate rooms set up. We had one with 4 patients, another one with 3. And we would call the patients and we would say, are you, this is something that your doctor ordered. Are you interested in getting it? And then if the patient would say yes, then we would say, okay, what we're going to do is we're going to head out and we are going to provide you with an N95 mask after you hand sanitize. Go ahead and put it on, hand sanitize again. We're going to bring you into these rooms. We're going to check your vitals before we give you the infusion. We're going to give you the infusion. Continue to monitor yourself and your vitals. And then we'll monitor you afterward to be sure that there's no type of reaction. So it was definitely a learning experience. All this medication is administered intravenously. So we would bring everybody in, get all of the IVs started, all of the vitals taken, make sure that these patients are okay while they're receiving this infusion, and then send them on their way. And then, so now we're getting the swing of things, and it's like, I remember our CNO, the chief nurse officer, and she came and talked to my boss, and my boss comes to us and he's like, he goes, you guys have done more infusions than like the hospitals in our area, just you two. He goes, so I just want you guys to know that you guys are going to be recognized. And we were, and it was just like, again, just an honor to be able to keep these patients out of the hospital and help them recover quicker. There were a couple of patients that were, they were not well enough. They would get there, and it was like the severity of the illness was not what it was 2 or 3 days ago. So we would have to take those patients down to the ER to be sure that they're going to be okay. Do they need more medical attention in the hospital because their symptoms are so severe? So that was really a big thing. So we were juggling being the staff that was administering this medication, trying to get as many of these patients in as possible, and then juggling our regular duties as nurses within the OR as well. So that was, again, it was an honor to do that. I think another big thing, historically speaking, that I was a part of was administering the vaccine. We were, again, I think we were one of the first entities within Clayburgh County that we were able to, we did like a vaccine drive to where we started vaccinating people. And so that was another way that I made up, the time that was missed, where we were lacking because of the shortage of elective surgeries that we were able to do. So definitely a whole bunch of stuff that, was, I think that it was, again, an honor to be a part of, to be able to help people, get better, recover, keep them out of the hospital, keep them from reducing their risks of contracting COVID as well. So definitely a lot of things for sure.
I have questions. I wrote some down. So for the Regeneron infusion, where did you end up doing it after all? Did you do it in the OR? Did you, and also what is the importance of negative pressure?
Okay, so we ended up doing the Regeneron in the COVID unit. And the reason that we chose the COVID unit was because in day surgery, you have to have healthy patients come in and have surgery. They have to be cleared if they've got cardiac ailments. They have to be cleared by the cardiologist. Their labs have to meet criteria. They have to test COVID negative, whatever. So they have to be healthy patients. So we collaborated with our superiors and said, hey, you know what? I think we'll keep COVID outside of day surgery, which is why we decided that we were going to go ahead and do the Regeneron infusions in the COVID unit. The reasoning before negative pressure rooms is we do not want any type of airborne illness that is really severe, i.e. COVID, tuberculosis. Though we don't want the same air that the patient is breathing to be, go through the cycle of going through the central air conditioning system and then to be spread out to the rest of the hospital and potentially get other people sick. So what the negative pressure does is it takes that air and it just it gets rid of it out of that room, out of the hospital. So it was very, very important to have those conversions made to the rooms that were not being utilized in the hospital to be able to have a COVID unit to treat the patients that were sick.
And so you mentioned that one of your one of your co-nurses was uncomfortable administering the infusion. That was because she was concerned about contracting COVID, not necessarily because of the infusion itself. Is that correct?
Yes, that is correct. And I think too, and I think that it was a concern for me too, but it's like, then later, after pre-COVID, I went through some life-changing things. I ended up getting divorced, and it was no longer an option of, okay, well, I can stay late, or I can leave early and go home. It's more of like, I need to provide for my family, and also if I can help out, there was such a shortage of nurses that I know that we started getting contract nurses coming in, so it was like, we I had to do what I had to do, so, and the shortage too, like I'm seeing my fellow coworkers, like of course you get fatigued and you get tired, and your mental health, and like you need time to decompress and to just take a break, so to be able to offer that to my colleagues, that was an honor too, to be able to just be able to help somebody else out that had been working, 3/12 straight, and they're still short and they might have to work a fourth. So those are things that I try to take into consideration to help others, because it's a lot. And then you go home and you still have to be a mom, you still have to be a daughter, you still have to be a tia. So it's like there's still house chores that need to be done, the yard still needs to be done. So it's juggling all of these things, just on top of being a nurse. So it was sometimes quite exhausting mentally, to go through what I went through as a healthcare professional with this type of thing. So definitely just trying to help out.
Did you see positive results from the Regeneron infusion?
Absolutely, absolutely. At the end of the day, the end of the week, I remember being approached by the CNO, and she said, you guys helped 30 something people stay out of the ER today. You helped out so many people not be hospitalized today. So that was very, very, it was nice to hear that. Definitely nice to hear that, and worth, the suiting up and the masking up and the gloving and the gowning. And, one of the craziest pictures that I think that I have from COVID was a day that we have our surgeons, they have these huge, it almost looks like, the best way I could describe it is like kind of like part of a spacesuit. And it's like this huge, it's a helmet, and there's a covering that goes over it with a clear front to be able to see. And it completely goes over, all the covering goes over the helmet and then down above the shoulders, and I would tuck it underneath the gown that I was wearing. And the purpose of the helmet is, for me during the pandemic, was to keep cool. You're keeping cool, you're still gowned up, you're still protecting yourself, keeping yourself protected. But I for some reason, that photo that I have always comes to my mind when I think of COVID, or when I think of Regeneron. And it was nice to be able to use that, because not everybody else had access to use that in the hospital. But since we worked in the OR, and these were things that our surgeons would use, they lent them to us so that we could use them, working hand in hand with these patients that were needing this infusion.
Now I want to switch over a little bit to the vaccine. So when you found out that the vaccination was available, how did you feel about that?
On a personal level or a professional level?
Let's start with on a professional level.
Okay, so on a professional level, I felt like I kind of had mixed thoughts. And I could say that I still have some mixed thoughts about it. I feel on a professional level that, opinion based with my answer is that I didn't feel that there was enough research to be able to say, hey, this is safe. It hadn't been around long enough. Looking at other vaccines that have been developed, there's a minimum time frame of 4 or 5 years till they started using these previous vaccines, and that's at a minimum level. And we're talking about less than a year that you know there a vaccine was generated and is now being administered to our society. So I again, I still have mixed thoughts about it, but I saw just the reassurance that the patients felt within themselves, like their own opinion, because there were also patients that were very against it. There were nurses that were very against it. There were nurses that were very pro vaccinating. So it was very, very, very different. And on a personal level, I was very on the fence about getting it. And for me, I would personally, opinion again, I feel like the fear factor. And I am vaccinated, but again, I felt that the fear that I had with this vaccine, not the vaccine, I'm sorry, the COVID itself, and I'll come back to that in a minute. I'll let you know why I decided. The fear factor plays in, and I start seeing people I know in the ICU. And what happens with COVID, it starts off where on the severe cases, you have patients that they're having a hard time breathing on their own. So there's a vital sign that we check. It's called oxygen saturation. And we also check the respiratory rate. So when you check somebody's oxygen saturation level, that's telling you how much oxygen is being perfused like throughout the body. Okay. And typically it's like a little clip that goes on the finger or a little sticky thing with an infrared light. And it'll tell you, is the patient oxygenated? Are they being properly oxygenated with their intake of oxygen? So you look at that and it's like, okay, when I did home health work before becoming an RN, anything below 95 is concerning and we need to inform the doctor, unless they've got comorbidities like COPD, other things, pulmonary fibrosis, then those lower ranges are going to be expected because they're already sick. So you have these patients coming in and they're struggling to breathe. Oxygen saturation is at 90, 88, in the 70s, some in the 60s. So they start, depending on the severity of the hypoxia, low oxygen saturation, you have to give them oxygen. So they'll start out with like a normal nasal cannula, which goes over the ears, comes around, and then, goes in both nares, each nostril. And then COVID progresses. And then it's like they're having to use a higher flow of concentration of oxygen with a different method of administration of the oxygen. And then they're starting to use masks, kind of like what you would see somebody that has sleep apnea. They would use BiPAPs. So you're progressing from just a nasal cannula, high flow concentration of oxygen, and then on BiPAP. So there were these patients that it was just going downhill for them and their health. And then after the BiPAP, it's being ventilated, like they have to be put on a ventilator. So I'm walking through ICU one day, and I see young people that are intubated. And I see other people that are like middle-aged, don't have anything wrong with them as far as their health history, and they're already on the BiPAP. And then you go in the next day and it's like, then they're ventilated? Like, how did that happen? So it's like, you see these, and then COVID causes a lot of viscosity, so thickening of the blood. And then these patients start getting, they'll have a heart attack. And then to prevent that, they're being put on blood thinners, you know, and then the heart is also working extra because they're not oxygenating properly. So their heart's working double time to get what little bit of oxygen it has throughout the system, to keep the patient properly perfused. So, and then they're put on drugs that are nephrotoxic. They're toxic to the kidneys. So then later, if they do make it out, which was, very rare, from what I recall, they're going to be on dialysis the rest of their lives because the toxicity of these drugs has caused kidney failure. So you look at all of these things and it's like, do I really want to take that chance? I'm just going to get vaccinated, So, and that is what drew me to getting vaccinated. And, I still have my reservations about it, but it did give me some type of comfort. Like, okay, well, I got the vaccine. So, it was just more of like, just my personal opinion, Miss Nicole. I don't, and to each their own. I'm glad that I did it because, like I said, it did give me a sense of like security.
Did you have any side effects after you were vaccinated?
After the first one, no. After the second one, I recall my lymph nodes and my axillas and my underarms that were quite sore. But other than that, no. Thankfully, no.
Now let's talk a little bit about healthcare. You work in the healthcare profession, but you feel comfortable still, going into the healthcare setting now, going into a doctor's office, getting checked out, taking Matilda to the doctor? Are you feeling a little bit better as far as COVID?
Yes, absolutely. I think that from where we were initially, there's a lot more research. We've got medications that have been used to treat COVID patients that have helped. I think that we have definitely progressed from where we started, for sure. As far as like now, for me and my family, I still wear a mask, definitely hand sanitize. We do go out to eat, but stay away from everybody else like any other time. So those are things that I think of that were like, before it was like, we're scared, we're not going anywhere. And now, like, we've progressed to like, hey, we can go out and be safe, and enjoy ourselves, and not have to keep ourselves secluded and just at home. So I think that just following COVID precautions, we're okay. We're doing much better than we were when this first started.
Great. Well, that concludes the majority of my questions. Is there anything else that you would like to add?
I don't think so. I know that I contracted COVID the latter part of December 2021, and it wasn't even from work. I don't know where I picked it up from, but I thankfully was able to keep from acquiring COVID at the hospital, for sure, where I worked. I don't know where I picked it up from, but it wasn't from work. So, but I think that's it.
How was that experience for you?
It was definitely unusual. I noticed that I didn't feel myself. And immediately my daughter was with her father, and I said, I'm going to call her dad and let him know, like, I don't feel comfortable because of just the way that I feel picking her up. So I think she's going to have to spend a few more days with her father. And my son was home, my mom was home. And I just remember I don't feel right. I ended up testing myself here at home with a home test and came out negative, but I still continued to um, quarantine myself. And then a day or two later, I retested and came back positive. But I was able to, was for me, it was like having a cold. Fortunately, it was like having a cold. And I thought to myself, I was like, you know what? I'm going to continue to stay in my room, continue to drink plenty of fluids, take my vitamins, and I recovered well. So I'm just super, super thankful for that. And, being able to experience what my patients experienced and to know what they were going through, I think the hardest thing for me was being quarantined and not being around, you know, people. So that was really hard. So I wouldn't even want to imagine how, you know patience, that was one thing that I don't want to bring up to you. For me, it was I wouldn't want to imagine what it would be like to be in the ICU sick to that capacity, or even on the COVID unit to that capacity. And then you're restricted from having family members come in and visit you and check up on you. you know um Fortunately for me, I was home and still from a distance be able to see and talk to my family. But I wouldn't want to imagine what it would be like to be sick to the point where, you know, I can't even have interaction with my mom or my dad, or to be that sick to where you don't know how much longer you have, and to be alone your final moments. So that definitely hit me very hard for the patients that were that sick during that time where visitors were restricted.
Did either of your children or any close family members contract COVID?
My son's father contracted COVID. He was actually in the COVID unit. And my son also contracted COVID. So it was definitely very, we have a very good relationship. We co-parent very well. And I would, check up on him when I was able to, take him things that he needed. My son did very, very well. It didn't even seem like he was sick really, other than, like I said, almost like a cold for him. But um, Caleb's father ended up having to be on oxygen. He was put on blood thinners. He spent close to 2 weeks in the hospital. So it was very, very, it definitely took a toll on him. But he recovered well and he's doing well. So it makes me happy that he didn't have any long-term effects. Some patients have to be on oxygen the rest of their lives. So he was very fortunate.
How did you manage taking care of your son while he was COVID positive?
So the way that worked was he had been around his father shortly after, or somebody that got sick, that his dad had him around, and his dad had already recovered, so he had antibodies, so his dad didn't get it again. So when he got sick, he was with his dad. So I asked him, I said, just the symptoms that you're telling me about, I said, I really think that he needs to go to Driscoll so that way he can get checked. Please make sure that they test him for COVID. And later that evening at about midnight, he called and he said, hey, Caleb has COVID. And I said, okay. I said, so if you could please, I said, just till the quarantine period is over, are you able to keep him there? Because they had already all been exposed. So I was kind of trying to keep my daughter safe and make sure she was fine. And then, making sure Caleb is fine from a distance, taking him what he needs, doing virtual visits with him, and making sure that he was okay in that regard, just to be able to make sure that my daughter was safe here at home.
I'm sure that was a very, very difficult decision for you.
Yes, absolutely. It took a lot of thinking and trying to, figure out what is going to be the best solution for this situation. And it was definitely very, very hard.
Overall, looking back on your experience through the higher part of the pandemic, what do you think about that? I mean, how do you process all of that?
Um, elaborate for me a little bit on what you mean with the higher.
Like, we're already in 2022, and it's kind of the tail, I mean, not the tail end, it's obviously still going on, but in the
Right.
midst of the big uprise when everything was just kind of shutting down and everybody was scared and wasn't quite sure what to do. Now that you're reflecting on that, I mean, what do you think of all this? It seems almost like a movie.
Yes, and I still feel like that. I think that it was kind of like a blur, like a quick blur. Like we need to get it together. We need to use our brains, and do as best as we can with what we were given. On in mentally, like we don't know how we're going to treat this. What supplies do we have? The shortage of supplies. So there was a lot of like, oh my gosh, like this is nuts. It's crazy. Where did it come from? What medicines are we going to give to these patients so that we can help them get better? Then we've come so far. We've got a vaccine. We had the Regeneron, and now it's like, we've done very well. Initially it was very, very scary, very, very concerning, on so many different levels. But I think from where we initially started to where we're at now, we've definitely come a long way. There's so much information now that we have that we didn't have initially. And it has helped us get to where we are now. So I am very thankful for being a part of that part of our lifetime, to be able to share that with family, to share that with my kids at a level that they're able to understand when they're older, to share pictures with them and tell them my experiences, as their mom. So, or with their children when they have children. So I think that it's very, very it was a huge learning process. And I think that as a whole in society, we've done very well.
Well, thank you very much. I really appreciate you taking the time to speak with me
Absolutely.
today. And the
Yes,
information
absolutely.
that you've provided is going to continue to help people. So
Awesome.
I appreciate it. Thank
I
you.
thank you. I appreciate being given the opportunity.